this question is asking us, what does the medical abbreviation SOB commonly indicate? So this means that the letters SOB are an abbreviation or an acronym for another medical term. Now, it's important when we see commonly indicate, this is important because we want to use abbreviations that are commonly accepted or understood so people understand what we're discussing when we use them. So let's look at option A. We see shortness of breath. And this starts with an S, has an O, and then a B. So it's possible here that SOB could be discussing shortness of breath, SOB. And it is, in fact, a commonly used acronym or abbreviation that might be used in a patient's chart to quickly discuss what the patient's symptoms are. Shortness of breath. So this is likely our answer choice, but let's go through the other choices to be sure. Swelling of abdomen, maybe this B is part of it. However, swelling of the abdomen is discussing maybe another symptom, possibly related to an ascites, maybe to an edema, which all relate to swelling, ascites specifically to the abdomen. And in this example, swelling of the abdomen doesn't correlate to the abbreviation SOB. So we wouldn't use in a patient's chart or discuss a patient having SOB and expect other people to think that this is talking about swelling of the abdomen. Now let's look at option C, severe abdominal pain. Again, this is another symptom that a patient may be experiencing, but if we use SOB when we're describing this patient, other people we're discussing it with would not be thinking of severe abdominal pain. They would likely think you're discussing shortness of breath. And then stiffness of the back, very similar to choices B and C. These are real symptoms that a patient might come in experiencing, but again, if you use SOB to describe stiffness of back, people probably won't know that you're discussing stiffness of back. So considering all these choices, our best option here is SOB or shortness of breath.